One of the causes of abdominal pain on the right side is an inflamed appendix. The appendix is a small, narrow, finger-like sac extending from the colon. When the appendix becomes inflamed, it is termed appendicitis. An inflamed appendix is filled with pus and causes severe pain to the person. Here is what you need to know. In this article we will be talking about what causes appendicitis, types of appendicitis, appendicitis in pregnancy, can appendix cause miscarriage? The appendix sits at the junction of the small intestine and large intestine. It's a thin tube about 4 inches long. Normally, the appendix sits in the lower right abdomen. The function of the appendix is unknown. What does appendix pain feel like? The most important sign is a sharp pain in the right lower segment of the abdomen. It starts near your belly button and moves to the right. It feels like cramps, a pulling sensation. Appendix pain gets worse when you walk, climb stairs, laugh, or cough. What are the early warning signs of appendicitis? The early warning signs of appendicitis include abdominal pain on the right side that radiates to the right lower quadrant. This is usually the first sign. Vomiting and nausea shortly after noticing belly pain, swollen belly, loss of appetite, fever, constipation, inability to pass gas. Types of appendicitis. The types of appendicitis include acute appendicitis or chronic appendicitis. Acute appendicitis. This is a sudden and rapidly progressing inflammation of the appendix. The signs and symptoms become unbearable within a day or two. It can rupture after a while. Is acute appendicitis an emergency? Most times, it is an emergency. It may require oral medications or an appendectomy. Appendectomy is the surgical removal of the appendix. An urgent surgical procedure will prevent the rupture of the inflamed appendix. Chronic appendicitis. Chronic appendicitis causes abdominal pain on the right side that comes and goes. The usual complaint is mild or severe pain on the right side. Appendicitis is the most common cause of abdominal pain leading to surgery in the United States. It occurs in more than 5% of Americans. Chronic appendicitis can be a result of obstruction or inflammation of the appendix. Can you live with chronic appendicitis? Chronic, unlike acute appendicitis, is long-term. The symptoms also come and go. You can live with it for years, but take note of the signs and symptoms. It is possible to have ruptured in chronic appendicitis. A ruptured appendix will cause the pus to spill into the abdominal cavity. This can lead to a severe bacterial infection of the bowels. What causes appendicitis? To be honest, the cause of appendicitis is unknown. Most experts believe it occurs when there is blockage or inflammation of the appendix. A lot of things can occlude the lumen of the appendix. They include enlargement of the lymphoid follicles. During constipation, the stool in the bowel can become hardened, leading to blockage of the appendix. Abdominal tumors, trauma to the appendix, intestinal worms. When the appendix is blocked by any of the listed items, the bacteria cells multiply. There is a formation of pus in the sac which leads to inflammation of the appendix. The inflammation can cause severe abdominal pain on the right side. Other conditions that can cause abdominal pain on the right side include stomach pain, gallstones, pancreatitis, medication side effects, diverticulitis, gluten intolerance, gastroesophageal reflux disease, constipation, thyroid problems. Continue reading now at MOXIBER.com. Don't forget to like and subscribe to the channel for more health tips.